Hi, good evening, good afternoon to everyone. Thanks for joining me. Firstly, I'll have a quick apology. We were supposed to have a chat with Dr. Chetty today, but due to technical difficulties, we're rearranging that possibly for another day this week. But I still thought I should give you an update as to what I think is going to be the focus of that discussion. And that's around the fact that a human virus that infects bacteria has never happened before. Let me repeat. I can't find any evidence of a virus or a bacteriophage that also infects humans or a human virus that also infects bacteria. This is one heck of an elephant in the room. The different kinds of elephants that we're dealing with in the pandemic. One of them we know we're talking about with excess deaths. But there is another elephant that, if you don't get your head around it, is going to come back and bite you. And so, what I'll be going through today is a timeline with regards to HIV to give you an idea as to the seriousness of what we're facing. And I will make sure that you get an early glimpse of this paper to see the relevance of what it is that I am talking about. So before I start, I'd just like to remind everyone that Macmillan Research is always open, giving you information, sharing you about the hypothesis around autoimmunity that I've been sharing since 2020. And critically, for those who are interested, there are courses, free and paid courses that are available that if you want to understand a little bit more about how COVID impacts the population, please make sure that you register. The link is in the description. So let's get back to this question. I just want to make it clear for thinking people that there is a fire. The building is burning. I don't want to alarm you, but I think that this is pretty serious and you should try and leave. That's the kind of situation that we're in at the moment. It's like a fire is occurring and people don't seem to get it. They're arguing about all kinds of historical stuff. They're still trying to focus, I guess, on what politicians did or didn't do. But we have a real problem in front of us. So, just to give you an insight into what it is that is occurring, is that this paper, and I'm not going to go through it in any great detail because I hope to get the authors, Dr. Carlo Brogna from Italy. He's one of the authors that I've interviewed before. I've already previously interviewed Joachim Gerlache, and so hopefully I can get them to talk about this paper. It was only published the 23rd of February 2024. And critically, just in the abstract, it tells you straight away what is the problem. The bacteriophage behavior of the SARS CoV-2 during the acute and post COVID 19 phases appears to be an important factor in the development of the disease. The thing that you have to grasp, the big word here, is the bacteriophage behavior. Okay? This is the burning building kind of thing. So let me remind you what it looks like. The bacteriophage is representative of the fact that viruses or virus-like organisms can also infect bacteria. And an example of where that is relevant is with diphtheria. Most of diphtheria bacteria are not pathogenic, they don't produce a dangerous toxin, but a specific bacteriophage that infects them could then make them produce the diphtheria toxin, which can then cause all of the complications with the heart and the kidneys and so on. So, bacteriophages are relevant in the context of well known diseases. The truth, though, is that a bacteriophage that infects bacteria doesn't normally infect humans. And the converse is true. There are many viruses that affect humans. There are many viruses that affect animals. But because of entry receptors and differences between the species, oftentimes you don't have a crossover. It's possible, but it's very rare. So, like bird flu could potentially cross over and it can cause a significant influenza in the human population. But the majority of them are species concentrated. So, when you have a virus a human virus that also potentially infects bacteria, that is a different kind of beast. Now, just so that you grasp what I'm talking about, I'll again tell you a simple concept. If this is correct, it's the equivalent of accidentally finding some cyanide in your cup of tea. Now, you're at work, you are about to drink it, somehow you didn't, and then it turns out that it was tested and it was found that cyanide was in it. It's possible that the cyanide could have fallen from the ceiling, or potentially somebody walking past could have tripped and dropped it in your tea. But for you to exclude the possibility that someone deliberately dropped it in your tea is a little bit naive, to say the least. So, this is the other elephant in the room that needs to be addressed. And again, I do not understand anybody with a scientific mind, with no conflicts of interest, who can hear something like the fact that we still don't know the origin of this complex virus and is not asking questions. I think it's a pretty good chance whoever dropped the cyanide in your tea is going to do it again. That's the reality. So, getting back to the point here is that when we look at the paper, and again, I'm not going to go into it in great detail yet, but this is just an excerpt from it, and it's showing us here what they had already found. They found that, in effect, increases in viral RNA occur when you put the bacteria in the contact with the viral proteins. And so this is their example of how they assume the virus enters the bacteria. And once inside the bacteria, it then seems as though the bacteria produce a number of strange toxin like peptides, endotoxins. And it's this that can then damage the lining of the epithelium. Now, this can happen, in my view, not just in the gut, but also in the upper airway and potentially in the lungs. This is really pretty serious. And the research has demonstrated that bacterial flora change. And this occurs not just with infection, but also with other sources of spike protein. So there is something about that entry receptor that is extremely dangerous in the sense that weaponizing bacteria is a pretty serious complication. So, just so that you get it into context, I've brought up here the timeline of HIV. Why did I pick HIV? What you have to understand is that when there is a time lag between um, a specific action and the outcomes, it's very difficult to connect the two. Okay? That's similar to what happened with regards to HIV. And taking you through the timeline of HIV helps you to understand just how serious this kind of thing can be. So let's remind ourselves what happened in 1981. This is taken from the HIV.gov, which is looking at the timeline of HIV. And in June 5th, 1981, they first published a report about pneumocystis carnii, which is a type of pneumonia. And they had found it previously in healthy gay men in Los Angeles. And then on the same day, they had their first case of someone who had an unusual cancer Kaposi's sarcoma. It then started to get some attention, and by the 11th of August in 1981, they had a meeting to try and raise funds to investigate it, because at that time in 1981, the primary focus was around the fact that it seemed to be concentrated in the gay community. And so there was a lot of misinformation, lots of stuff shared around as to what was going on and why it was. So it really did cause a bit of concern. But what you have to remember is that, so this is 1981, and I'm going to show you what happens in 1988. So this is now 7 years down the line. And you can see here that in 1988, a teenager ended up, he was talking about the stigma of AIDS. I think he had gotten it from a blood transfusion. And so at this point, you just realize that 7 years after, they hadn't even made the connection that there was a risk in the context of blood transfusions. And so you're starting to see that only in November did they approve federal funds for AIDS prevention, education, and testing. This is 7 years after this was spreading in the community. Now, this is where I need thinking people. Those who are not thinking will not understand what I'm saying. Just imagine that instead of 15 months, HIV was about 3 or 4 years. Okay? You have to remember that with HIV, the initial infection is oftentimes asymptomatic or very mild. And so someone could have the infection, be infected with HIV, have very few symptoms, and then they would spread it to their partner. If their partner, depending on promiscuity, it would then spread. And so just imagine, instead of 15 years, you take 4 years before AIDS presents. So AIDS is when the immune system has been so damaged that the immune system can no longer respond. So, if you had 4 years and you had a situation where HIV was spreading throughout the community, in homosexual community, heterosexual community, blood transfusions, needle use, and drug users, and no one did anything about it, imagine what would happen in 5 to 10 years. I say again, the building is on fire. We need to understand what is going on extremely quickly. This characteristic that we call a bacteriophage pattern is really, really serious. Here is the image. Remember it. This is what they have been finding. Nobody wants to talk about this. For some reason, it seems that there is able to be replication inside bacteria. And as I said, we will cover this sometime soon. And they found in the paper that very early antibiotic use was significant in terms of getting good outcomes. This is an example of what they showed in the paper in terms of duration of illness and times. And this is with here antibiotic treatment within 3 days, antibiotic treatment after 3 days. So you can see the clear difference in terms of timelines for recovery in terms of the use of antibiotics. This is absolutely stunning, huge piece of research that helps us to understand a little bit more. But again, I tell you, anyone who underestimates this virus is clearly not doing science. This is a beast. This is not to be underestimated. This is something that we really need to treat seriously. And in that vein, anyone who underestimates the potential damage of the spike protein, I don't know what to say. We really need thinkers now. We really need to try and find solutions, and we really need to put the pieces together. So continue to follow us. Hopefully, I'll talk with Dr. Chetty again soon, and we'll explore this a little bit more detail when he had that similar prediction in 2020. Have a great evening.